Nestled in the hills that border Naco, Mexico, 200 miles southeast of Phoenix, is the old mining town of Bisbee. In the late 1800s, these barren hills boasted the spirit of the Old West. When early explorers discovered copper, it soon became known as the Queen of the Copper Camps. But behind the veil of the history and color of this small town lies a big problem.
You don't see poor, unhealthy people on the street. They're a hidden, untouched population, and we really need to work to get to that group of people.
Arizona's Department of Health Services released its first statewide health assessment in February. It lists Bisbee as one of the state's most at-risk communities when it comes to health care. On the unpaved backroads of Bisbee, where children's toys and trash litter the hills that support these decaying homes, I met Clay Edwards and his dog Lily.
I was born here, yeah. Born here, basically off and on raised here. I'm a Bisbee kid.
24 years old, earning $8 an hour in construction, Clay faces a challenge familiar to many residents of rural Arizona. He's medically uninsured. Let's say you do have an emergency. You need to get care immediately. What do you do?
Super glue and duct tape.
If you're choosing between dinner for your kids on the table or a copay at the doctor's office or even paying the entire cost of the doctor's visit, people naturally choose their basic living needs.
If something happened to me, I'd pretty much, either starve to death or, something. I don't know. Nobody's going to work for me.
They don't seek out preventive services. They don't have a doctor that they go to, and so they utilize the local emergency rooms. 17%
of Arizonans live below the poverty level. Focus in on Arizona's rural communities, and that number rises. In Bisbee, nearly 24% live below the poverty level, which is why emergency rooms like Copper Queen Community Hospital often bear the brunt.
I have a patient that we're sending up to UMC.
Since all these patients are seeking care in these more immediate ways, it's very expensive and a challenge to have trained people ready to meet that need.
The emergency department has only 9 beds, serving Bisbee's population of over 5,000.
The average patient where this is an issue is pretty young. It's very hard for them to imagine that they really do have this health crisis. They could be just trying to make ends meet.
Or maybe they just need to be steered in the right direction.
We have to just continue to figure out how to reach those people. How do we find them? How do we educate them?
Even if I got to dig a ditch, to eat that day, if that's what I got to do, I can do it. At least I can do that.
At least as long as he stays in good health.